The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own health, which are general questions about a vacuum device. So, the first question is, how natural does the erection from a vacuum erection device feel? Let me tell you guys a little story, and that is that I have tried a great variety of methods to treat erectile dysfunction because I feel, as a male sexual health specialist, that I should be able to tell my patients how things feel. So I've tried Viagra, I've tried Levitra, I've tried Cialis. I like them, they all work great. I've also had a vacuum device that was given to me by one of the companies, and I said, let me try this out and see how it works. And I find that it works pretty well. It feels like a firm erection that is definitely suitable for sexual activity and for penetration. I find that the ring, for some patients, they report it can be distracting, but for the most part, patients are able to reliably have sex using the vacuum device and the ring with good sensation and with a useful penetrative erection that they're happy with. Number two, is there any value to cheaper models you can purchase on Amazon.com? Does the quality of the device make any difference? Yes, absolutely, 100%. So lower quality vacuum devices will break easily and are unreliable. The devices are best purchased from a reputable, reliable medical device dealer like MenMD. These devices will be more durable, more effective for you, last longer, and give you, not to pun too hard here, but we give you more bang for your buck, basically. These devices should last a long time with proper care, let's say 5 or 10 years or so for many of my patients. And again, the more you put down at first and the more of a reliable product you buy, the more likely the device will last a good long time and be safe and effective for your penis. When you buy things on Amazon.com, I'm sure we've all had this experience. You buy something, and what comes in the box is not what you thought it was, does not resemble the product in the picture, and is not of the highest quality, so it breaks within a few days. I, for example, have a toddler, and I bought many things for him, and they have been broken within a week or so. So, again, I think a reputable medical device dealer like MenMD is the best place to go for the circumstance, and you should get the best vacuum device your budget can afford. Next, how much pleasurable feeling of ejaculation is lost or diminished using the vacuum erection device? As I've said, patients have noted to me over the years that ejaculation is made more difficult due to the presence of the ring, but most patients report adequate sensation during sexual activity that allows them to have an orgasm and to ejaculate, which is pretty much what we want out of sexual activity. Do VEDs facilitate penile growth? This is a very loaded question. The answer is, with consistent, regular, safe use in a planned regimen that you're consistent with, penile length can increase with a vacuum erection device. Gains in the literature about this are variable, very variable, but I would say on average, after looking at all these studies over the years, it appears to be maybe between 1 to 2.5 centimeters of penile length gain with consistent, regular, safe use of a vacuum erection device. Would I recommend a VED for venous leakage? This is also an interesting question. So to go back and refresh our memory to our original slide that we had talking about this, a vacuum erection device is going to have the ability to pull blood in your penis and to trap it in there using the ring, because it mimics the two different types of erections, the two different processes that happen during erection. One process is to get blood in via the arteries. The second process is to keep blood in there by compressing the veins shut. Many patients have venous leakage erectile dysfunction, which is less common than an arterial problem without getting blood into the penis properly. Venous leakage means you can't keep blood in your penis very well. And for those patients, a venous leak patient is going to have pretty decent success with a vacuum device as well, as long as you find the right balance in ring size needed and the ring fits you properly and compresses the penis appropriately to keep blood in your penis. What is the best routine as far as how much time a day, how many erections are in a session, and how long to maintain each one? And I want to leave this slide up for the whole rest of our conversation if we can, because seeing me jibber jabber is not as important as seeing this regimen. So slide 13 and slide 14, the one before this and the one after this, take pictures of this right now if you can with your camera on your phone or with your function on your phone where you can take a screenshot. But this slide is very important. I'm going to give you guys a second to take a picture of this slide while I talk. And then the next slide is also important as well. Ashton, in a few minutes, just kind of progress the next slide so they can take a picture of that one as well. Again, there have been many variations of these regimens in the literature. This is just as sensible as any other. It seems safe. It seems easy enough to do. And this one is already written down for you, so go with this one. The next question, is there a therapeutic benefit to using the pump but not using the ring? Yes, as we talked about, that benefit is for things like penile rehabilitation, penile reconditioning, penile length changes you're attempting in your penis. That is what not using the ring is going to provide for you. The ring is what you need for sexual intercourse. If you try to use a vacuum device and don't put a compression ring at the base to maintain that erection, you're not going to be able to have a particularly successful erection. Number 8, I have a vacuum erection device at home, but I have not used it for almost 2 years. Will it still be effective? My answer to that, try it and see. And if you're on right now, whoever asked this question, try it right now, and in the chat function or the question function, update me on how it's going. But try it. If you have one at home, you haven't used it, will it still be effective? Try it out, give it a shot, and see how it goes. If you have any problems or you have success, I'm here for another little bit here, and I want to see your update and let you tell me how it's going. Which devices allow you to install the ring and then use the pump? And so that question, I think, is asking me, can you put the ring on your penis first and then use the pump to suck blood in your penis? And I don't know of any devices that do that because it is counterintuitive. The whole point of the vacuum component is to suck the blood into your penis. The ring is to compress your penis. Therefore, if your penis is being compressed by this ring, you will not be able to suck very much blood through this ring. So again, I don't know of any devices that do that. And if you ask this question, please, by all means, my follow-up question to you is, why do you ask? I'd like to know what the proposal behind that question was. Excuse me. Okay, number 10. Can a vacuum device help restore penis length that was lost due to lack of erections for several years? Follow-up question. Does the penis lose elasticity from extended periods of no sexual activity? My answer to that question is yes. See slides 13 and 14, which we just talked about. You took pictures of. But also, the follow-up question, yes, absolutely. Does the penis lose elasticity from extended periods of no sexual activity? The old maxim of if you don't use it, you lose it is absolutely true. No question. Erectile dysfunction causes penile length loss. How much? Nobody knows for sure. The speculative answer is maybe a half a centimeter for every year of complete erectile dysfunction. Is that true? I don't know. Paul Perito says it is, and I like Paul Perito a lot. He's a very good surgeon. Sounds right to me. But realistically, by that I mean when you don't have an erection for a long time, the tissue inside the penis atrophies. When it atrophies and shrivels up in those two corpora cavernosa, that atrophy is both in volume loss, as in the penis gets narrower, and also length loss, the penis gets shorter. Other thing that happens for penile length loss over time is that guys get heavier. As you get heavier, your belly tends to slide more over your penis, and in doing so, you have cosmetically less penis available. But realistically, erectile dysfunction and Peyronie's disease and prostate cancer treatment all cause reductions in penis length and a vacuum device can help restore blood in there and help stretch the tissue out to get you more penile length in response to that loss. Number 11, does a vacuum erection device work better than penile injections or meds? That is a very loaded question. My answer to that is, it depends on what you want, right? If oral medications don't work, vacuum erection devices will probably work. All methods have their pros and cons. It really depends on what you want with your erection. So again, the classic 4 methods for restoring erections are pills, which at some point stop working for guys, a vacuum erection device, which works throughout the entire time spectrum of erectile dysfunction, injections or medications you put in your penis like suppositories or gels, which also stop working with time, and a penile implant, which also is a bit more labor intensive than the other ones. When patients come to see me to talk about their erectile dysfunction, I offer them a smorgasbord of options of those 4 things. And I say to them very clearly, I don't get paid by the penis. I get paid to tell you what the options are, and you decide with your partner or by yourself what is most appropriate for your sex life. So if a vacuum erection device is what's appropriate for your sex life, go with a vacuum device. Absolutely. Number 12, will a vacuum erection device help a man that is 84 years old? My response to that is sure, absolutely. Vacuum erection devices, as I said, will help anybody across the entire spectrum of erectile dysfunction. Other options either have limited use or are not appropriate for certain guys, but vacuum devices will help you throughout any age, any type of erectile dysfunction. A 30-year-old guy, a 50-year-old guy, an 80-year-old guy, a vacuum erection device is a useful tool that can help. Number 13, no luck with oral medications, no luck with injections. Is this an alternative before an implant? It certainly is. It is both an alternative to other pathways and its own pathway in and of itself. You can use it as you see fit. It may work for you, and if you like it, well, it'll probably work. But my point is, it may work for you, and if you like it, you stick with this. You do whatever works best for you. Number 14, Trimix, Cialis, and Viagra don't work for my ED, and I am a 13-year insulin-dependent diabetic. Would this method be effective for me? My response to that is probably. Many guys will have a good response to vacuum erection device. I can't say for your case specifically because I haven't met you, but try it and see, right? What harm is there? You spend a little cash, you get a little vacuum device, you see what happens. If it works and you love it, you've solved the problem. If it doesn't work, you see a male sexual health specialist who can help you with this process. Next, do you have a percentage of success for patients that have used a vacuum erection device? This is a good question. I write a lot of literature about, a lot of scientific articles about treatments for erectile dysfunction. I keep very good data about certain populations that I treat with erectile dysfunction. I have very good information and lots of studies about my patients who had penile implants, and the same for patients on injections, the same for patients who use oral medications. Unfortunately, it has been to my discredit that I have not kept great records on my patients who use vacuum devices. So I cannot specifically offer you a percentage of patients who are satisfied with the vacuum erection device, at least not scientifically. What I can give you is my personal feeling about what guys who use vacuum devices come back and tell me. And in my experience, almost all of the patients who've used a vacuum erection device have been happy with that treatment modality for them. So that's a very high percentage from my perspective. Is it true that the ring at the base of the device prevents you from ejaculating? And how long can you remain erect? The ejaculation bar we talked about already, but how long can you remain erect? As long as you keep the ring on, which again should not be more than 30 minutes, right? As soon as you take the ring off, the erection will start to dissipate and go away. The ring, as we said, compresses the urethra, and that compression makes it difficult to ejaculate. How difficult? It can still happen, but it requires a little bit of force to get the semen out of you past the compression ring. Number 17, what type of vacuum erection device is best for veno-occlusive erectile dysfunction, also called venous leakage erectile dysfunction. Again, I answered this a little bit earlier, but they're all probably equally useful, if that's the question. If the question is which vacuum erection device is useful, the answer is they're all equally useful. If the question is what method to treat erectile dysfunction is useful, of those four we talked about, pills, injections, vacuum device, and surgery, venous leakage erectile dysfunction is hard to treat with medications that go in your penis. That is because those medications are designed to put blood into your penis, not to keep it there. And so venous leak erectile dysfunction is not always particularly responsive to injection therapies. Is shaving the pubic area required for proper results? Again, as I said, grooming your pubic hair is very, very helpful for both forming a good seal using the big boy and the regular guy, and also for removing the ring, because you take the ring off, you grab these ear flaps and you pull it off your penis, and when you do so, you could potentially pull some pubic hair with it. So shaving is not necessary. Grooming is perfectly good and works just as well. If you have to, shaving is actually not really recommended for guys in my practice. I don't recommend guys shave their pubic hair because when you use a razor, you introduce nicks and cuts in the skin, and those nicks and cuts can have germs follow, and you could get local skin infections, folliculitis, boils. That's not great. But a nice groomer, a nice beard and mustache groomer, or a Norelco body groomer that they have, these are fantastic. You can groom your pubic hair very well and really get to a level where it's short enough that you can form a tight seal and get the ring off easily, but also not too complicated where you're having to shave and do this very regularly and stuff like that. Again, grooming is very useful. And also, by the way, just objectively, guys, grooming your pubic hair makes your penis look a little bit bigger because it's not buried in pubic hair. So just as a side note, that's a side tip for your benefit. Is there an alternative to shaving one's groin area to obtain a good suction fit, i.e. using Vaseline? Typically, you don't want to use Vaseline because you're using a lot of lube around the rim of the device, around the seal, and around the penis itself. Again, I think grooming your hair is much better. If you want to maintain long pubic hair and use Vaseline, you're going to run into quite a messy situation. It's going to require a lot of cleanup, and it's going to be lingering in your pubic hair for a few days afterwards. So I wouldn't recommend that particularly well. Why would one not get an erection firm enough for penetration after using the vacuum erection device? Two main problems. Number one, size issues. So, for example, you didn't use the right seal to seal the penis into the vacuum device. Number two, you didn't use the right ring to compress your penis adequately. And number three, body size issues. Vacuum erection devices work very well on guys who are slender. I'm not saying that chubby guys like myself should not use this. Chubby guys can use it too. But my point is that if you're a very heavy guy with a lot of flab around your penis, it's going to be hard to form an adequate seal and to get your penis into the device particularly well. So the main issues guys run into are going to be inadequate constriction ring choice or inadequate seal choice. But body habitus can play a role in this as well. So again, those are the three reasons that guys may have a hard time getting a decent erection from this. How do you take off the cylinder without losing any firmness? That's a good question. Logistically, that answer is you put the ring on your penis by sliding it off of the seal, and then you press the vacuum release, right? So you have to get the ring off the vacuum seal and onto your penis before you press the release valve. Don't release the release valve until you have adequately compressed the penis with a ring. Can vacuum erection devices damage the penis? Most vacuum erection devices, especially ones that you buy from reputable medical device dealers, are vacuum limited, so they will prevent problems with overinflation or over compression of the penis and over vacuum pressurizing. If you buy a bootleg machine from Amazon.com that comes from God knows where and is of low quality, those are less safe. But most reputable vacuum erection device manufacturers and reputable vacuum erection device medical device dealers will sell you a safe device that is unlikely to be harmful for your penis. Number 6, my vacuum erection device works fine, but the rubber constrictor doesn't maintain a hard enough erection for penetration. What can be done? My suggestion is to try a smaller ring, and particularly get a good set that gives you a wide variety of ring choices, right? So you want to have 5 or 4 rings to choose from so you have an adequate setup for that. If that is not successful for you, particularly my friend who asked this question, you should see a male sexual health specialist and have them take a look at you and see what's going on. Can the suction process rupture veins and arteries? Yes, we talked about this earlier. The suction pressure can rupture superficial skin level veins and arteries, particularly on guys who have blood thinners. So guys who take blood thinners for health needs are more likely to have bruising that is superficial, that resolves after a few days. But again, the average guy is not going to have any kind of rupture that is concerning or unusual. And even guys who use blood thinners, you're going to have some mild bruising, typically because of the suction pressure. Number 7 is a very specific question. I have one of these, but so far I can't get it hard or long enough for sex using a constriction band. Any tips? My tip for you, sir, specific to you because it's a very specific question, is I want you to go to smsna.org. That is the website for the Sexual Medicine Society of North America. I want you to find a male sexual health specialist in your area. You can go to our website, smsna.org, and you will find numerous qualified, fellowship-trained male sexual health experts who can help you with this problem. I'm not sure I can help you with this problem online through this webinar format. Is there any danger if you have an iliac aneurysm? The answer to that is not that I know of. These are sucking blood in through superficial vessels inside your penis, or deep vessels inside your penis. The iliac arteries are way behind that point. I'm not aware of any danger to your iliac artery aneurysm in that circumstance. But again, this is not discrete medical advice during this presentation, but not that I know of. Do I need to be erect to use a vacuum erection device? No, not at all. In fact, you should put a flaccid penis inside a vacuum erection device. That is the most useful place, useful way your penis should be to put get the device to work properly. How do you know when to stop pumping? This takes some trial and error because you have to find the erection rigidity that works for you and your partner, and you have to find how many pumps or how long of pumps of the motor is required to get to that rigidity. My answer to that question is I don't know, but try it and figure it out and fiddle with it. And when you have one, talk to your doctor who prescribed it for you to figure out exactly how to do that best. But realistically, it requires some thought and some tinkering and making the device work for you. My pump has various rings to adjust the circumference of the opening. What criteria do I use for choosing the proper size? So this question is specifically about, do I pick this guy or this guy, right? Do I pick the big ring or the small ring? Again, the big ring is that diameter. The small ring is this diameter, somewhat narrower. The answer is, globally, the answer is take a look at your penis and see which one you think works better. But more specifically, when you go to use this and you have one that is too big, you won't form a tight vacuum seal, and you'll know that's the problem. If you go to use the one that's too small for your penis, you won't be able to get your penis in there. So that'll solve the problem too. So really it's about trial and error and figuring out what works for you, but more specifically, too big, vacuum won't stay. Too small, penis won't go in. That's it. Is it normal to have reduced sensation in the tip of the penis when the ring is installed at the base of the penis? Yes. And again, as I mentioned, that is because the ring is compressing both the urethra, which is on the underside of the penis, right here, and the dorsal nerves, which provide sensation to your penis, which are on the top of the penis right here. That compression results in some guys reduced sensation, but not in all guys. Some guys feel perfectly fine. A lot of it depends on what health conditions you have may contribute to this process. For example, a long-standing diabetic is going to have penile neuropathy, in addition to having neuropathy in his fingers, neuropathy in his toes, and neuropathy with vision issues as well. So that may make this problem worse. But realistically, most guys will be perfectly fine with this. Okay, vacuum erection device and other modalities. I just completed an unsuccessful Xiaflex 4-cycle treatment for Peyronie's disease. Is a vacuum erection device safe for me to use? My answer to that is yes, it is safe for you to use as long as it's been about 6 weeks since your last Xiaflex injection. If the question is it going to change my Peyronie's disease? The answer is probably no. What is the recommendation for the use of a vacuum erection device in combination with Cialis? My response, this can be done perfectly easily. I have no concerns. You can use a vacuum device to help augment the suboptimal effect that you're getting from the oral medications. Can I use a vacuum erection device with an inflatable penile prosthesis? This question, again, is one of those questions that if you ask this question, please send me a chat function or a question follow-up so I know why you asked this. Because my answer to that question is yes, you can use a vacuum device with a penile prosthesis, but why would you want to? And so if the problems with the implant itself causing you some issue or another, then I want you to go back and put the implant in your penis or to somebody else who can also perform that surgery and figure out why the implant's not working for you. Can a vacuum erection device be used in conjunction with injection therapy? Yes, it can, but injection therapies should be dosed properly to the right strength for you that helps you efficiently get an erection. So if you're not getting a good erection with your injection medications, what I would really suggest is that you go back and see the prescriber who prescribed them and figure out what else needs to be done. Number 5, is it okay to use a constriction ring with the vacuum erection device when you have a 3-piece penile implant, or will it damage the implant? My answer to that question, again, to the previous question that was asked, is yes, but why do you ask? Is there something wrong with the implant that would warrant you wanting to use a vacuum device? If the implant is not sufficiently inflating properly, if the implant doesn't fit right for some reason or another, these are things to go back to the person who put the implant into your penis and ask them directly, or to find somebody new to take care of the implant if your question is not addressed appropriately. Please describe penile rehabilitation with a vacuum erection device for post-prostate treatment. There is some evidence that a vacuum erection device helps improve penile tissue oxygenation. One of my very good friends, Chuck Welliver at Albany Medical Center, wrote a study on this when he was a fellow years ago that showed very clearly the blood that the vacuum device sucks into the penis really helps because it restores a lot of oxygen to that tissue. And so this may help guys who have penile atrophy and fibrosis and internal scarring because of the circumstances of prostate cancer treatment or in general. What is penile reconditioning? Again, I hope you guys took pictures of slide 13 and 14 to help show you that. Penile reconditioning, penile rehab, kind of synonymous terms. What they essentially mean is getting blood into your penis to help restore and nourish and make that tissue more healthy and more functional. It has been over 2 years since I had the removal of my prostate. Since then, I have had no sign of an erection. Is it too late? It's never too late, my friend. See a male sexual health specialist who can help you with this problem. I want you to find somebody who can help you. I want you to get back to a healthy, happy sex life. It's never too late. Get back on finding somebody. smsna.org. That's the Sexual Medicine Society of North America, where you will find well-trained highly focused, highly specialized experts in male sexual health who can help you find what you need. Can I use the device since I have just been positive in a prostate biopsy with a small percentage of that area? Yes, absolutely. Go right ahead. No concerns from my end on that whatsoever. I now have prostate cancer. Please describe all available sexual options after prostate removal or radiation treatment. That, my friend, is not a conversation I can have in this very limited time form we have here. I still have another page of questions to go. What I strongly recommend is that you find a local, highly qualified, well-trained male sexual health specialist who can help you with this process. There are many options. If you're in my territory, if you live in northern New England, Massachusetts, Vermont, Maine, New Hampshire, Connecticut, and western New York, come see me. I'm happy to take care of you. If not, find some way to get in contact with me and I'll find the guy who's right for you. But you need to see somebody to help with this process. I cannot explain all of these things, the options available to you right now at this forum. Is it possible to regain length following a prostatectomy or following radiation therapy or after Peyronie's? Yes, but length gains are limited and require safe, reliable, consistent use of a vacuum device. And again, don't get your hopes up. You may have less gain than is reported in other studies. You may have gain that you really are hoping for, but I would say try it and see what happens. Length gains are possible. They just require diligence and reliable, consistent use. In addition to vacuum erection device, what other tools or meds should those of us post-radical prostatectomy be doing, and how often and at what point should we stop? My friend, very good question. I like your question very much. I want you to go to smsna.org and find a qualified male sexual health specialist. Some of these questions in this particular section of the questions are very specific, and my answer to that is that this is not the forum for me to answer those questions, but I want you to find the resource that you need because I want you to find somebody who can help you. So smsna.org or Google, whoever's local in your area, you want to find a male sexual health specialist who is fellowship trained and who can help you in this process. General urologists can also be helpful, but may lack the expertise that you need and want. After radical prostatectomy surgery, my penis length has decreased significantly. Will a vacuum erection device restore or improve penis length? Possibly, but with limited gains. Post nerve cutting prostatectomy, when nothing else works, would a vacuum erection device help? Probably. Try one out and see. And if not, there are other options that can help as well. Okay, last couple questions here. How can a vacuum erection device help with Peyronie's disease? Well, a vacuum erection device can help with length loss, but not with curvature. Vacuum erection devices have not been sufficiently shown to improve penile curvature. Is it reasonable to utilize a vacuum device to combat Peyronie's disease? No, that is not the best choice to combat Peyronie's disease curvature. For length loss, maybe. If you have Peyronie's disease and you have significant concerns about your penis, I want you to find a qualified male sexual health specialist to help you with that issue. Is erectile dysfunction caused by atherosclerosis? That is the general term for hardening of the arteries. The answer is yes. The most commonly linked thing to erectile dysfunction is aging. Beyond that, other conditions make erectile dysfunction happen more quickly and worse. Diabetes, smoking, high blood pressure, high cholesterol, coronary artery disease, atherosclerosis. These accelerate the process of erectile dysfunction. I have arteriogenic ED with dysfunctional cavernosal arteries bilaterally. Which vacuum erection devices will work, if any? Any vacuum erection device may potentially be of use to you, sir. With that, it's 7 o'clock, guys. I don't see any questions in the chat function. Ashton, do we have any other questions that I'm missing at all?
Yeah, you're not actually able to see the chat, so we did have some there, which we answered a decent amount of them, but one of them that we need to cover before we answer or end the event is a follow-up to the IPP and constriction ring question. So the follow-up is, the VED makes my implant erection firmer and larger, so I'd like to use a ring.
Man, there's a lot of stuff I want to say to that question. That's a very good response, and I appreciate that response. If you are not having an adequate erection that is not firm enough with your penile implant, then I would strongly suggest that you find somebody who can revise that implant to one that is a better fit for you. That is probably a much more suitable choice for the long term than using a vacuum device. Vacuum device is not going to hurt your implant, but I am concerned that your implant is not right for you because you're not getting what you want out of it, and you're having to use a supplementary method to improve the quality of erection, and that is not good. And so what I would strongly suggest is that you find somebody who can help with that. Come see me. I'm happy to take a look. I don't know where you are, but if you want to fly out, it's a nice time of year to come out here. The sun is shining. If you want to come out in the wintertime, it's less pleasant up here. But again, if that is why you're using a vacuum device, I suspect your implant is not good enough and needs to be worked on.
If you'd like to learn more about VEDs, you do have a few options. There are more resources available on the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. You can also contact MenMD support if you have a question and would like to speak to someone in person. You can do this by calling MenMD at 857-233-5837, or if you're a MenMD member, you can log into the password-protected secure MenMD portal to schedule an appointment with a MenMD personal health assistant. If you'd like to purchase a VED or learn more, you can do so by visiting the shop page on menmd.com, or again by calling our office at 857-233-5837.